Bonjour à vous tous. En tant que ministre canadienne du Développement international, je suis ravie d'être ici pour célébrer la Journée mondiale de la santé avec vous. Nous avons des nouvelles passionnantes et Grands Défis Canada a des projets très intéressants à vous présenter. Comme nous l'avons constaté très clairement au cours de la dernière année, la santé mondiale est un sujet qui touche de près la vie quotidienne de chacun et chacune de nous. Et si nous cherchons le soleil à travers les nuages, l'année écoulée nous rassure et nous encourage en démontrant la capacité des communautés à pivoter, à se rassembler et à surmonter les obstacles avec souplesse et vision. En d'autres termes, avec innovation. L'innovation consiste à créer des solutions locales nouvelles ou améliorées pour obtenir de meilleurs résultats et un impact plus important en donnant des moyens d'action aux plus pauvres et aux plus vulnérables, en particulier aux femmes et aux filles. Trouver la meilleure façon de traverser cette crise est essentiel pour mettre fin à la pandémie actuelle. Mais cela signifie aussi que nous serons mieux préparés pour réagir à la prochaine. La COVID-19 a exposé tant d'inégalités à travers le monde et a souligné la nécessité d'être souple, agile et de répondre aux circonstances continuellement changeantes. C'est quelque chose que Grands Défis Canada a pu démontrer pendant la pandémie. Nous en saurons plus sur Grands Défis Canada et son travail novateur dans un instant. Mais j'ai d'abord de bonnes nouvelles. Depuis le financement initial du gouvernement du Canada, 6 millions de vies ont été améliorées et plus de 29 000 vies ont été sauvées. C'est pourquoi je suis fière d'annoncer un investissement de 200 millions de dollars dans Grands Défis Canada. Le soutien du Canada à GDC a aussi ouvert la porte à d'autres investisseurs. Pour chaque dollar que le gouvernement a investi dans les innovateurs soutenus par GDC, 2 dollars a été investi par d'autres partenaires. For more on the organization and their work in the field, I am joined by co-CEO of Grand Challenges Canada, Jocelyn Mackey.
Hello, bonjour. Thank you, Minister Gould, for inviting us to be a part of your spotlight on Canada's role in global health. Au cours des 50 dernières années, la Journée mondiale de la santé a été une occasion importante d'attirer l'attention du monde entier sur des aspects vitaux de la santé mondiale. On behalf of fellow co-CEO Dr. Carly Silver and myself, as well as Grand Challenges Canada's board and entire team, I'd like to acknowledge and thank the leadership of the Canadian government in demonstrating its renewed confidence in our organization to deliver impact through innovation.
Well, Jocelyn, we're very happy to, and of course, the results speak for themselves. I'm hoping that you can, in a nutshell, start by explaining what your organization is all about.
Yeah, I'd love to. So it's really the innovators we support who truly make the platform what it is. The reality is that life-saving and life-improving innovations usually take years to move from seed to scale to maximize their impact. And this is where Grand Challenges Canada has made a difference. It's also why the long-term commitment by the Government of Canada will be so transformative. En 10 ans seulement, Grands Défis Canada a démontré l'importance de son créneau unique dans l'écosystème mondial de l'innovation pour l'impact. So at Grand Challenges, we're able to take on innovation risk that other investors are not able to manage, really for the purpose of enabling innovators to succeed. Innovation is needed, but relatively few seed innovations can successfully and sustainably go to scale.
So maybe, Jocelyn, you can talk a little bit about that and what makes Grand Challenges Canada so special.
Our Transition to Scale program is really at the core of what we like to call our collaborative advantage. We first seed bold ideas to test what works. And then we transition to scale with funding to help catalyze the scale, the sustainability of innovations that have already proven of having an impact on health. So only 8% of impact investors really fund at this early stage. And so that's where the transition to scale investments really help fund this funding gap. But it's not just about the funding. Our approach also provides really targeted technical assistance and linkages to other partners or funders to help fill gaps that innovators may have in knowledge, in resource, or in networks. Another element that I like to highlight are the diverse partnerships we have across the public, private, and philanthropic sectors. One example is that we work in collaboration with the Grand Challenges Network, and this includes the US government, the Bill and Melinda Gates Foundation, Grand Challenges Africa, India, Grand Challenges Brazil, and many others. We're also a non-state actor in official relations with the World Health Organization, working together to help scale health innovations. I guess the last thing I'll say is that how we do our work and the results achieved align with Canada's Feminist International Assistance Policy, which emphasizes, the real importance of innovation as a means of increasing Canada's effectiveness in advancing gender equality.
So I've always been so impressed by the results that Grand Challenges has achieved. I mean, sometimes it's actually just mind-blowing to think about what you've been able to accomplish. Could you maybe put it into perspective for people? I mean, in terms of how many people exactly have you helped?
So to date, we have supported over 1,300 innovations and thousands of innovators in over 100 countries around the world. These innovative products and services have the potential to save 1.78 million lives and improve 64 million lives by year 2030. None of these results would have been possible without our partnership with Global Affairs Canada. And it's the impact that these innovators are already having that we're celebrating today. I feel very humbled and proud to work with them.
That's really cool, and it is inspiring to see, the tangible impact of the work that GCC does, and of course the support that you provide to innovators, a couple of whom we're going to be talking to a bit later on, who are going to tell us exactly what they're doing. Is there anything else you'd like to add?
I will mention that we recently celebrated our 10th anniversary, which was a really exciting milestone for us. And looking to the future, this renewal of GCC's platform for 7 more years will allow us to also incubate new Grand Challenges programs to address emerging challenges through innovation. And by leveraging this new funding with dollars from other investors and partners, we're going to keep supporting innovators to develop new ideas, transition to scale, locally driven innovations that really improve the health, the human rights, and the well-being of women, adolescents, and children in low-resource countries.
That's great to hear, and it's so encouraging to hear about the direct action that you're taking towards finding solutions that have the potential to make a real difference in people's lives, and particularly their health outcomes right around the world. And I think that these are so crucial, these solutions that we're talking about as we look for a way forward for humanity. I mean, we talked a little bit about the impact that Grand Challenges Canada has had during the pandemic. But even some of the stuff that you were doing pre-pandemic has actually benefited local communities and responses to the pandemic around the world. And I'm really looking forward to us kind of drilling down and learning more about the projects that GCC is funding on the ground. And I understand that we have some very impressive Canadian talent at the heart of these solutions. Maybe you want to talk a little bit about that?
Yeah. Me too. I'm very excited. So our first innovator is joining us from Edmonton. He is Dr. Michael Hawks, Associate Professor in the Department of Pediatrics at the University of Alberta. He's going to be talking about an innovation called solar-powered oxygen delivery. So that's as a result of a partnership between the university and Global Health Uganda Limited. So their innovation saves lives, which I think is super cool, by using freely available resources, the sun and the air. Oxygen is an essential medicine, and COVID-19 has made the delivery of oxygen even more urgent. So solar-powered oxygen delivery This is a great example of an innovation developed by Canadians, partnering with colleagues globally, funded by the Government of Canada through Grand Challenges to save lives in low-resource countries. Michael, thank you for being with us today. Could you start by telling us more about the innovation and the challenge that it's addressing?
Hi, I'm a pediatrician and infectious diseases specialist here in Edmonton, Alberta, and I run a research program in global infections, including childhood pneumonia. So childhood pneumonia is actually the #1 leading cause of child death in the world today, and most of these deaths occur in low and middle income countries. Oxygen is an essential medicine for the treatment of childhood pneumonia, and of course the COVID-19 crisis has also dramatically increased the need for oxygen globally for adults as well as children. But oxygen is not easy to come by in many hospitals in Africa, particularly in the remote and rural settings. So you've got pressurized cylinder oxygen, but that depends on a reliable supply chain. Next, you've got oxygen concentrators, but they depend on a steady source of electricity. So when I was working at the pediatric hospital in Jinja, Uganda, we had cases where small infants dependent on oxygen could even die when the power supply went out. So we came up with solar-powered oxygen delivery to provide a stable source of oxygen on the peds ward. We used solar panels and a battery bank and an oxygen concentrator to deliver reliable oxygen off the grid 24/7 for children with low oxygen levels. And so we started with a proof of concept project in Uganda, and then we ran a randomized clinical trial comparing solar oxygen to cylinder oxygen, and we showed that solar oxygen was equivalent in terms of clinical outcomes, but of course it's better in terms of reliability. So now we're implementing solar oxygen at 20 sites across Uganda, proving that solar oxygen saves lives. And our preliminary analysis is showing a 35% reduction in mortality. And we've also installed solar oxygen systems in the Democratic Republic of the Congo and most recently in Somalia. And of course, none of this would be possible without our strong team of Ugandan nurses and doctors led by Robert Opoka and Sophie Namasopo, who run the oxygen systems and treat the children in Uganda.
Wow, Michael, that's a pretty incredible story and really amazing to hear about the impact that this innovation is having and the life-saving impact. I mean, it's really, really amazing to hear. Could you maybe share with us how support from Grand Challenges Canada has helped to take solar-powered oxygen from an idea incubated here in Canada to implementation and impact in East Africa at a time when medical oxygen is in such high demand?
Yes. So Grand Challenges Canada has been our major supporter from the start. Our proof of concept and randomized trials were funded through GCC's STARS in Global Health program. And our current 20 hospital expansion is funded by GCC's Transition to Scale program. I should also mention some of our other funders, the Women and Children's Health Research Institute at the University of Alberta, Rotary International, and Open Society Foundations. GCC has also been a great source of encouragement and help to take our innovation to the next level, making connections to local governments and partners like the World Health Organization, and that was what enabled the most recent scaling out to Somalia. And so we're aiming to develop a sustainable plan to continue to expand solar oxygen in East Africa and beyond in order to maximize the number of children we can reach with this innovation. And Grand Challenges Canada has really been instrumental in allowing that scale to happen.
Oh, Michael, that's just fantastic. And it's really, really encouraging to hear of the work that you're doing, leading out of Alberta, but that's having such a tangible impact in East Africa. So if I can just say thank you for your incredible work and the work that you're leading with your team. And what I find so exciting about this is that there are already 20 sites benefiting from this oxygen therapy system right now as we speak, with the potential for more to come. And I think that for so many people, the picture you painted at the beginning about how, well, first of all, why medical oxygen is important, but why it's important to have sustained energy access and how that can have an impact on health outcomes is really, really important. So thank you for that. And thanks so much for joining us today. Jocelyn, is there anything you wanted to add?
Yeah, Minister, I agree. It's the impact the innovations are having and will continue to have sustainably over time that really matters to us. So next up is a Kenyan innovation from Northstar Alliance East Africa. Northstar has developed an innovative model of primary health care designed for female sex workers and the communities that they interact with, really to meet people where they are and people who are usually missed by the healthcare system. COVID-19 has really amplified the importance of Northstar's innovation, underlining stark inequalities in access to health and social supports for the hardest to reach populations. So here to tell us more is Ava Mwai. She's the organization's regional director. Ava, thank you so much for being with us today. If you could tell us a bit more about what is unique and innovative about your approach, and maybe perhaps how you're partnering with local health systems.
Thank you very much. Northstar Alliance has for many years been partnering very closely with the government, and this we do through the blue boxes. We deliver our public health services through converted sea containers, which are strategically located along transport corridors. Of course, there you find so many people who move, including sex workers, and that's our concern. As you know, sex workers in Africa are highly stigmatized and discriminated upon. So what we do is to hit the nail on the head by going where they are if they cannot come where we are. And our model is built around providing primary healthcare services and ensuring that these girls are, at least we have reduced gender-based violence, and that they feel dignified. They feel dignified and are part of everything that we do. One of the things, the innovations that we have come up with is through the recognition that we need to partner with the sex workers and with the communities if we are going to make any impact, especially on GBV. And so what did we do? We formed crisis response teams. This involves the sex workers themselves selected and police, security officials, religious officials, the Ministry of Health, and all that. We have gone to the extent where the Ministry of Health will actually provide some of the supplies that we need for health services for our girls. And we go out with the ministry officials to meet the girls at the hotspots. Now, one of the very amazing things that we shall, I think, forever live to talk about is the impact that the government of Canada has enabled us to make in the communities where we work. One, during the COVID, and we are still in the COVID phase anyway, I don't know what we would have done without information and just public education and sensitization, and then purchase of PPEs. So that was one thing that was timely, and we have seen a lot of change. Our clinics have remained open despite, and we've been able to serve despite the COVID-19 pandemic because of the support that we have received.
Ava, thank you so much for joining us today and for sharing the really interesting and important work that you're doing on behalf of the Northstar Alliance. I'm wondering, and thank you for acknowledging the support from the Government of Canada. We're very pleased to be able to support this work because you're reaching a population that wouldn't necessarily be served without it. Could you maybe talk a little bit about how the Northstar Alliance has been addressing the specific health needs of female sex workers during the COVID-19 pandemic, and maybe how it's changed since the pandemic came on?
We have used a dual approach. One, in our blue boxes, where we have clinical officers, HIV testing and counseling providers, and a host of other health staff. So when the sex workers come to the blue box, we are able to educate them and provide essentials like masks, educate them about washing their hands, and even keeping distance, maintaining distance. We remind them often about the need to take care of themselves. Then the other approach is actually going where they are. Outside or in the areas surrounding the blue boxes, there are hotspots, and hotspots are where the sex workers do their work. And whether it's during the day or at night, Northstar Alliance staff, plus the peer educators who are part of the sex workers, they go out, they provide COVID-19 education, and they provide masks actually to the community leaders, to the sex workers, some of them, because it's not easy, but we educate them also to make their own masks. And we have seen a great change in what our work entails, positive change rather.
I'm really glad to hear that. And I think one of the things that's interesting about the work that Northstar Alliance is doing is that sometimes when we think about innovation, we think it has to be technology driven, but you're also talking about the fact that it's also social innovation. It's about doing things differently and meeting people where they are, which is really important. So Eva, thank you so much for sharing the work that you're doing. Thank you to you and your team at Northstar Alliance for all the work that you're doing to get to those women and girls who really are vulnerable and who might not have access to healthcare if it weren't for the incredible work that you and your team are doing. And I have to say personally, sexual and reproductive health and rights of women has been a topic very close to my heart, and one that Canada is really proud to stand up for on the international stage. We've, all of us seen the rollbacks in gender equality brought about by the lockdowns and the pandemic. And so I just really want to say thank you to you for joining us today, and for all of the achievements that you've managed on the ground so far. And really pleased to hear that you're talking about the positive changes that you've seen over the past year as well. That's really good to hear. Jocelyn, is there anything else you'd like to add?
Thank you, Minister. I just think that Canadians should be super proud of the role that our country has played in supporting global health innovators like Michael and Eva. I find them really inspirational. So thank you, Michael and Eva, for sharing with us about your work and the impact you are having. Those of us living in a country with a relatively well-funded health system, I think sometimes we think we have all the answers, but I've always felt that there's so much that we can learn from innovators in other countries. So thank you again to the Honourable Karina Gould for your continued partnership. Nous remercions aussi nos nombreux bailleurs de fonds pour leur contribution, notamment le gouvernement du Canada, qui ont investi dans des idées audacieuses ayant un grand impact. And finally, thank you to everyone for watching today's conversation. If you'd like to learn more, please visit us at grandchallenges.ca. Merci.
Merci beaucoup à vous tous de vous être joints à nous aujourd'hui. Permettez-moi de féliciter chacun et chacune d'entre vous pour toutes les choses que vous avez faites pour changer positivement la vie des gens. Le bon travail fait ensemble en vue d'atteindre nos objectifs dans le domaine de la santé mondiale démontre à quel point notre partenariat avec Grands Défis Canada est une réelle source d'inspiration. Une inspiration qui, je l'espère, en motivera d'autres à trouver des solutions novatrices concrètes pour les personnes les plus vulnérables de notre monde. Le Canada s'est engagé à agir, à coopérer au niveau international et à aider à construire un avenir où personne n'est laissé pour compte. Et le partenariat et l'investissement avec des organismes dynamiques et efficaces comme Grands Défis Canada nous aideront à mettre de l'avant un monde plus pacifique. Merci beaucoup.